Well, pregnancy can cause all kinds of changes in a woman's body, and back pain is one of them. But you don't have to live with the discomfort. Here to tell us about better backs for moms is Dr. Caroline von Fluge from Balance Atlanta Family Chiropractic, along with expectant mother Britton McLeod. Thank you both so much for being here.
Thank you.
Doctor, let me begin with you first. Why is it that women experience so much back pain? Is it because of the weight gain?
Partly. My specialty as a doctor of chiropractic is in the spine and the nerve system. And as a mom develops, or as the baby develops, obviously she's gaining more weight. So the body has to compensate so that she can stay balanced. The other huge factor is that by the time a mom's, let's say, childbearing age, she sustained spinal injuries throughout her life, whether she was a gymnast or whether she was in a car accident, slipped and fell, carried a heavy backpack, sits at a computer. So it's the stress of that on the spine, as well as the mom's body's producing a hormone called relaxin, which causes the pelvis to get a little more soft and loose in preparation for childbirth. So as the spine's a little more flexible, those spinal bones can get out of alignment, which put pressure on the nerves, which can cause lower back pain, upper back pain.
Yeah, and a lot of traditional doctors, a lot of women just think that they have to deal with it. It's just part of being pregnant. But you say that there are some techniques that you can offer to alleviate some of the discomfort.
Sure.
And it also helps with the baby's health, too.
Exactly. My approach is this, especially in this country, there's so much fear associated with being pregnant, with the delivery, and to usher a new life into the world is a miraculous experience.
Yeah.
So why not make that as healthy and comfortable for the mom while she's pregnant, to make sure labor and delivery are as easy as possible, and also to put as little stress on that delicate baby's spine and nerve system during the birth process.
Okay, well, let's get Britton into place.
Sure.
So we can see you perform some of your techniques on her.
Well, this
explain
is
what
a
you're doing.
portable chiropractic table, and in my office I've got much bigger tables with all sorts of bells and whistles, and I'm not actually going to be doing an adjustment, but what I look for actually on a mom is I look at the alignment of her spine. And actually, Britton, if you don't mind, do you mind standing up for just a second? Obviously, with a pregnant mom, I'm not going to do x-rays like I would with another patient. And I check posture. I look for spinal distortions. And what I mean by that is oftentimes the head's more anterior than the shoulder, which puts stress on the upper back and the neck. Also, with pregnancy, there's an increased curve in the lower back, which again, because of the weight up front, there's more stress here.
To compensate,
exactly.
yeah.
Then I look at the scapula, the chicken wing bone, so to speak. Is one higher than the other? Is one rotated out further than the other? I look at the spine to see, is the rib cage symmetrical? If it's not, if one side protrudes more than the other, it could be an indication of scoliosis, where there's a curvature of the spine, which is not something you want to have. I also look at, if you just turn around and face the camera, I look at the symmetry of the head. Are the ears on the same level, or is the head tilted a little bit? The muscles of the neck, is one side protruding more so than the other?
Now, how many months along are you, Britton?
7.
7 months. And have you had treatments and adjustments with the chiropractic before?
Yes.
Okay. And
With all 3 of my
how's that
pregnancies.
with all 3 of your pregnancies? So it's been effective for you?
Yes, very.
Wow, interesting. All right, so can you show us something that you can do?
So this special pillow is something that I have in my office, and it's foam core, and it's got a little area that's hollowed out which can accommodate the belly, so the mom can actually lie on her stomach, which is very comfortable. And what I do, it doesn't look that exciting on air, but when I'm palpating, I'm examining the spine, I'm looking at the symmetry of the spinal bones. I'm also checking for any kind of muscle spasm, any kind of swelling. And someone who reads Braille, they can distinguish between the little points on a sheet of paper. I can't, but in 15 years of working with patients, my fingers, as my patients say, have little GPS finders on them.
Very sensitized.
Exactly. I can find out exactly where the problem is. And you can feel that by the muscle spasm, by the range of motion.
How many treatments typically would a patient need to come for during the course of pregnancy?
It really depends on her body. The more stress there is on her spine, the more frequently someone might want to come in. But again, my approach is not only if someone has back pain to help correct and alleviate the problem, but also to ensure that the spine is as healthy and flexible as possible throughout the delivery.
Okay.
So some come in for a few visits, some can come continuously.
Okay, excellent. Well, this has been very interesting. Britton, thank you for joining us this morning. Doctor, it was a pleasure meeting you.
Thank you very much.
If you're expecting or if you just want to feel better, check out